Do you know what COPD is and how it affects your lungs? The name might sound like a new tech startup or a secret government agency, but it's actually something much closer to home. COPD, or chronic obstructive pulmonary disease, is a progressive lung disease that can seriously affect your ability to breathe. Like a pesky neighbor who overstays their welcome, COPD includes two main conditions that make it harder for you to breathe: chronic bronchitis and emphysema. Chronic bronchitis causes inflammation and narrowing in your bronchial tubes, those passageways that carry air to and from your lungs. Imagine trying to drive through a tunnel that's getting smaller and smaller. Not so easy, right? Emphysema, on the other hand, destroys the air sacs in your lungs where oxygen and carbon dioxide are exchanged. It's like popping the tiny balloons that help your lungs function properly. Now, you're probably wondering, how does one end up with COPD? The most common culprit is smoking. Yes, those little sticks of tobacco that some find solace in can wreak havoc on your lungs. When you inhale smoke, it irritates your lungs, causing inflammation and damage. Over time, this damage can lead to COPD. But it's not just smoking that can lead to COPD. Exposure to certain gases or fumes in the workplace, air pollution, and even genetic factors can also contribute. It's like a bad lottery where the prize is a chronic lung disease, not exactly the jackpot you were hoping for. So how does COPD impact your respiratory function? Well, it's like trying to breathe through a straw while running a marathon. Not only does it make it harder to breathe in and out, but it also reduces the oxygen in your blood, which can lead to other health problems like heart disease. Now that we know how COPD affects the lungs, what can we do about it? Well, the first step is to stop smoking if you do. It's like taking the fuel away from a fire. It won't stop the damage that's already been done, but it can slow the progression of the disease. Secondly, managing COPD involves medications to help open the airways and reduce inflammation. Think of it as a soothing balm for your irritated lungs. Pulmonary rehabilitation, which includes exercise, education, and counseling, can also help you breathe easier and improve your quality of life. Finally, maintaining a healthy lifestyle can go a long way in managing COPD. Regular exercise, a balanced diet, and avoiding air pollutants can help keep your lungs in better shape. So, to summarize, COPD is a serious lung disease that includes chronic bronchitis and emphysema. It's most commonly caused by smoking, but other factors can contribute. It makes it harder for you to breathe and reduces the oxygen in your blood. But with the right management strategies, including quitting smoking, taking medications, and maintaining a healthy lifestyle, you can slow the progression of the disease and improve your lung health. Remember, your lungs are not just an airbag for your body, they're the vital organs that keep you breathing and alive. So take good care of them, because unlike a tech startup or a secret government agency, COPD is not something you want to have in your life.